welcome to a new episode of Around Kuwait, where we're shedding the light on different occasions, of course, and different inspiring stories. But today we have the privilege of welcoming of Mr. Ali Almehanna. He is distinguished as a pharmacist whose expertise and dedication have made a significant impact on the healthcare in Kuwait, of course, with a wealth of experience as a senior pharmacist at Mubarak Al Kabir Hospital, specializing in total parental nutrition of fruits. Welcome to Around of Kuwait.
Thank you. Thank you, sir.
First of all, let's talk more about your role. What is your role?
So I'm working in a total parental nutrition pharmacy. In short form, it's commonly known as TPN. So what we do, we compound, we manufacture and prepare pharmaceutical fluid in a designated bag. It's called a TPN bag, and we prepare them for patients who cannot take any oral feeding or internal feeding in the hospital. And this could be for many reasons, whether they have gone through surgery and have had complications, or patients with inflammatory bowel disease, such as Crohn's or ulcerative colitis. Those are the common patients we have. And these TPN nutritional bags that we prepare, they provide the patients with all their energy and nutrition that they need.
Oh, okay, that's interesting. Speaking behind the pharmacist, I think you have a lot of responsibilities, especially in the hospital. And we're talking about hospital, we're talking about Mubarak Al Kabir Hospital, which I think you have a lot of responsibilities out there. What is the responsibilities that you may do or you have, especially while you're supporting the patients themselves?
There are many aspects that a pharmacist can have in a hospital. We have many departments for pharmacists in a hospital. The big pharmacies in Mubarak Al Kabir Hospital, they are the surgical pharmacy and internal pharmacy. These two pharmacies, they provide the outpatient medications, which means that the patients who are going to visit internal medicine clinics. This includes diabetes clinics, endocrine or cardiology clinics. And for the surgical pharmacy, it includes patients who have gone through the surgical units or the urinary clinics specialties. These two are the main two pharmacies. They provide the medications for these patients, as well as the patients who have been discharged from the inpatient stay in the hospital. And then we have other pharmacies. We have a compounding pharmacy, or sometimes known as a pharmacy lab. They prepare patient-specific creams, gels, sprays, suppositories, and they're specifically made for each patient's needs.
You have mentioned speaking up the outpatients, and we want to know what is the role of extent of these clinics for the outpatient settings, and what services is there?
Mainly patient counseling. This means the pharmacist will explain to the patient about the medications that they're gonna take, whether it's suitable for them, whether it has interactions with medications that they already take, or herbal supplements and vitamins. They can explain to them side effects or precautions that can happen when they take these medications, as well as they can answer any question that the outpatients can have about their medications.
That's right. If you could elaborate for us on the pharmacist's involvement on managing the medical stores within the Ministry of Health, of course.
Yes, this is a critical department in the Ministry of Health. This department is actually located in Sabhan. The pharmacists and medical stores, they manage all the, let's say, the contracts, the quantities needed, the type of medications that the ministry needs for all the specialities that are required in Kuwait.
Okay. Speaking behind, we have talked, I think, before starting the show. I have mentioned, or we hear that a lot. A lot of pharmacists is much needed for a doctor, and a doctor is needed for the pharmacist itself. With them both, they cannot relay, especially when we're talking about any kind of patient that need any kind of meditation or any kind of, let's say, course, or depending on the case itself. So if you could talk more about that kind of role of the pharmacist itself, because a lot of people maybe thinks that a pharmacist is just a normal that giving a different kind of descriptive or any kind of medicine to any patient out there, of course.
Yes, this is becoming increasingly an important role for pharmacists in hospitals. They're becoming part of what we call a multidisciplinary team. This team includes the doctor, the pharmacist, the dietitian, the physiotherapist, even the social worker, and this team works together for the patient needs. And now, in the recent 3 years, pharmacists are becoming more involved in this multidisciplinary team. The pharmacist will look at the patient's medications, their past medical history, whether they have medication interactions, whether they need counseling, or sometimes the doctor will need some advice about the medications that help the patient's specific case.
So we always say that the doctor always needs the pharmacist, and vice versa. They complete each other,
Yes,
basically.
yes, exactly.
And since summer is coming up and it's approaching, what are some of the things of medications or treatments that you recommend, of course, especially when summer comes? I think there's a lot of sunburns, there is a lot of people that might lose any kind of vitamins and so on, because we all know that when summer comes, or people out there in the sun, they think they're taking, let's talk more about, for example, vitamin D or so on, and how there's a certain time that it might affect them, of course, and it might get them into sunburns, of course.
Yes, it's a very important topic to speak about. Many people we know like to sunbathe in the sun in the summertime, and this can expose them to sunburns. And the risk of sunburns can be really dangerous. It can expose the people to dehydration. So that's the first point we want to highlight. Patients need to, sorry, not patients, but people in general, they need to make sure that they're well hydrated when they go out in the sun, and to protect themselves, to put on sunscreen. Many people only focus on tanning and putting on tanning oils and forget about the sun protection. So this is an important point. And they can speak to any pharmacist that can help them about the choice of sunscreens.
Even speaking behind the sunscreens and the sun protections, I think we can use it daily, not only just during the daytime or the sunny days, of course. And I think a lot of people would not use that kind of sun protection or sun creams. It's because of maybe whitening or having that kind of layer that might block between their skin and the sun itself, of course.
Yes. Well, there are two important points. They have to know the SPF, which is the sun protection factor of sunscreens, and they should remember that the fairer their skin, that means the lighter their skin, they need a higher SPF to give them more protection, because the fairer the skin, the more prone to sunburns they are. They'll be. And the second point is to choose the right sunscreen, whether it's chemical protection or mineral protection, and this depends on the type of skin they have. They can ask their pharmacist in their local pharmacy. It really helps to have a well-planned sun protection.
Yes, of course. And speaking behind, since we have mentioned summer, I think a lot of people would be preparing to travel, and I'm one of the people, when I travel, I love to take, just in case, any kind of medicines or medications that I need. Speaking behind, if you have to prepare for traveling, what are the things or the essential things that may help you in order to be with you in case if anything happens?
Well, first of all, if you have any medical conditions, make sure to take your medications with you. And if you have any prescriptions, printed prescriptions, can take them with you just in case you lose your medications when you're traveling. Make sure you take your medications, but in a properly storage, in a proper way of storage. For example, if they're taking insulins for diabetes, or they're taking any sort of an injection, most of them require refrigeration, or to have an ice pack or an ice box with them, and to be taken with them abroad on the airplane, not with their luggage. That's an important point. Another point is to take some advice from the travel clinics. Not many people know about these travel clinics we have in Kuwait. In the primary clinics, there are clinics only designated for traveling, and you can tell them about the destination you're going to.
So it's basically in the airport itself? Yeah?
Not in the airport, in the primary clinics.
In the primary clinics, okay.
Yes. They can give you advice whether you need certain vaccinations or certain medications, let's say anti-malaria medications, to be taken with you, especially if you're going to Southeast Asia or countries that are known for malaria infections.
Speaking behind, you have mentioned, I think, vaccination and so on. Is it true that any kind of these countries, let's say if you're traveling, you must have that kind of vaccination for the health itself?
Yes. Just as I mentioned, some countries are more known to have, let's say, spread of hepatitis or malaria, or these common dangerous infections. And it's important to go check whether you have your full vaccination against these diseases before you go to those countries.
Okay. Beside also speaking behind traveling and preparing and all that, we all know that most of us, when we travel, the easiest thing to take, we take certain medicines with us in case if anything happened, for example, having Panadol or having that kind of any kind of medication. And whenever we're feeling dizzy or having that kind of headache and so on, each one of us, the only thing we would do is just take a tablet of Panadol. Is this kind of certain thing when you're having any kind of side effects, just having like a small headache or a bit of a headache, you get on, it's not that kind of extreme, that anyone would take any kind of tablet?
It's good to educate yourself first. This starts by maybe asking your doctor or your pharmacist about what painkillers you can take without prior advice, without a prior prescription.
Because a lot of people would take it without any kind of advice.
Yes.
The only thing would do, if you're having any kind of pain or any kind of cause that's affecting you or your health, is the easiest thing to take is any kind of tablets.
Well, we have what we call OTC medications. They're not. It's a short form of over-the-counter medications. These include paracetamol, which I have many brands in Kuwait, Panadol, Omol, all these brands. And these medications can be safely taken without going to the doctor or the pharmacist. Just make sure you read the leaflet on how many tablets you can take, because some people say it's just paracetamol, that this means I can take as many as I like. And if it's taken without the proper directions, they can actually cause liver damage. So this is an important point. Another point is the other type of painkillers. They're known as NSAIDs, which is short form of non-steroidal anti-inflammatories. So these include the Voltaren, the Brufen, the indomethacin. These medications can also be taken without a prior medical advice, but make sure to ask the pharmacist or at least read the leaflet before taking them.
Yeah, and I guess the time taking that kind of medication is what you need basically, because a lot of people would do a lot of mistakes by taking it more than once, or let's say I had that kind of descriptive from any kind of doctor or pharmacist saying, let's say taking it twice a day, so anytime I would feel that kind of cause or pain or what's so on is happening, I will just take it, and regularly by having it from time to time, I think sometimes it's not effective to the body itself, the medication itself.
Yes,
Yeah.
Just as taking them too often,
Yeah.
taking them less often may not give you the right effect.
Yeah.
So it's your point is really good. You need to take them as directed.
Yeah.
So for example, the paracetamol, they're commonly in form of 500 milligrams.
Yeah.
So the common dose is if you take one tablet of the 500 milligrams, it's taken every 4 hours. But if you take 2 tablets, which is 1,000 milligrams or 1 gram, it's to be taken every 6 hours.
Yeah.
And see the difference between taking 1 tablet or 2 tablets.
Yes.
And it can have a different effect with the pain that you're trying to relieve or the headache.
Of course, we're going to get to know more, of course, about Pharmacist and giving more advices to the audience. But dear viewers, after this break, we'll be back. Welcome back, dear viewers, with Mr. Almehanna, where we're talking about more healthcare and more medications and pharmacists, of course. Speaking behind, we spoke about people while they're preparing for summer, where they're preparing for traveling, of course. Now let's talk more about the people that make common mistakes with the medications itself, whether we're talking about expiry dates or storage. And I think a lot of us might have a lot of medicines at home and not seeing that kind of date of expiration, or it has been there for a long time that is stored in the house. Are we able to take these kind of medicines, and what are the effects behind them?
Yes, really good question. Many people think about medications that they all need to be stored in the refrigerator.
Yeah.
This is a common mistake because actually there are some medications that actually become degraded or become actually less effective if they're stored in the refrigerator. A common one is an antibiotic. Its name is clarithromycin. It's a big name, but it's commonly dispensed in the community.
Yeah.
And this example of medications and these antibiotics, they actually become hard when they're stored in the medications. They're in a solution form, or we actually name them a suspension form.
Yeah.
So the first rule I would say is to look at the manufacturer label, because they have specific storage conditions for each medication. Some liquids or solutions need to be stored in room temperature. Some others need to be stored in a refrigerator.
We always say that if you're having any kind of medicine that is liquid, just store it in the refrigerator, especially when we open it. And we want to know more about these kind of cases that we might think it's right, but as you have mentioned, sometimes it's not a good thing to have it in the refrigerator itself.
Yes, it depends on the manufacturer and whether they have included excipients or ingredients that are working as a preservative or not. Some solutions they have a high concentration of preservatives that can be used as the expiration date even after opening.
Yeah.
Other types, other solutions and suspensions maybe have less of these preservative ingredients, and they specify, the manufacturer will specify on the label that after opening, discard within a week or 14 days. So make sure you read the package and the manufacturer's directions.
Okay, let's talk more about the expiration of any kind of medicine, whether it was a solution, a liquid, or tablets. Does it have any kind of effects if you're taking, let's say sometimes we see kind of medicine that have been expired 1 day before, or 2 days before, or a week ago. Does it have that kind of effect, or are we gonna have that kind of medication after taking this medicine?
I have to say, professionally, I have to say, stick to the expiration date. But to be honest, solid form pharmaceuticals, solid form medications, such as tablets, capsules, maybe soft gels, a day or two, maybe a week after expiration, still can be safe to be taken.
Yeah.
Some specific medications that us pharmacists know, they are chemically stable, which means even when exposed to heat or humidity, they can still be fine. But others, and let's say we want the public to say to have the idea that all medications need to be stored away from humidity and temperature and heat to have their expiration date valid to the date that's written on the package. And a general rule also is that solid form medications, when they expire, they most likely will become less effective and not harmful. But maybe other solutions and suspensions, especially injections and ampules, for example, insulins, these you need to be very careful that you follow the expiration date, because they can be really dangerous to be taken after their expiry.
Yeah, so we're speaking more here into taking more care. So if we want to, let's say, give the individuals or the people there to ensure that they are properly storing their kind of medications, what would you tell them out there to maintain any kind of, having any kind of effective side effects or any kind, to be more safe, of course? A good rule of thumb is to have a specific designated area in your house, let's say a medicine cabinet or a box, to have all your medications in that place. Make sure it's securely closed, it's away from children. This is a common problem we have, that sometimes they're easy to be reached by children, and this can be really dangerous and toxic to them. So make sure they're away from heat, away from humidity, and securely closed, maybe in a higher place. Yes, of course. So I think everyone, all the individuals and the people out there should know more that not any kind of solution or liquid should be stored in the refrigerator. Some of them have to be, let's say, at room temperature, of course, and just check up with the expiration day and to take care more and not have that kind of having any kind of medicine at any time, even if it's expired before a day or a month or I don't know, something like that, of course. And speaking now more about, let's talk more about, since we have talked about medicines and storing, let's talk more about antibiotics. I think a lot of us out there would take any kind of antibiotic if they're having any kind of inflammation, any kind of pain or so on. Do we need to take that kind of antibiotic even if sometimes because we go into any kind of pharmacy, let's say we're not going into a hospital and the doctor did not request to have that kind of antibiotic, the easiest thing you would do, you would go to any pharmacy, the first thing he would say, just take an antibiotic.
Yes.
Is this a good thing to do?
Definitely not.
Yeah.
You raise a really good point here. Antibiotics are one of the greatest achievements the medicine has done the last 100 years. They make a huge difference in treating patients. But we need to make sure not to make them ineffective. This is because antibiotics, when taken without medical advice and without the need or the actual bacterial infection that you have, there is a problem that can happen, and it's increasingly happening in the world. It's called antibiotic bacterial resistance. This means the bacteria that's causing the disease, they become resistant to the antibiotics, and they will not work against these bacteria. And so make sure that you only take the antibiotic after proper physician or a specialist advice. Don't take them on your own.
And to be honest, I don't know if this is right or not. As long as I have, even if I have that kind of antibiotic perspective or description from any kind of doctor, or as soon as any kind of doctor that tells me you need to take an antibiotic, I would avoid it, to be honest. Because I think taking a lot of antibiotics through the years you're alive, it would affect the health itself. I think the body would come more weaker. Is this right or no?
To some point, yes. We know antibiotics, what they do is that they target bacteria and they kill them. So depending on the type of antibiotic and within a spectrum of types of bacteria, most of the time, you're not only killing the bad bacteria, you're also targeting the good bacteria that we have in our gut. And these bacteria, we call them the microbiome or the natural bacteria. And these bacteria have evolved with the human body.
Even I think the immune system itself would become more weaker. You don't have that kind of a strong ability in order to fight.
Yes. This microbiome actually helps the immune system, and they've had a symbiosis effect with the human body. So when you take antibiotics frequently without an actual bacterial infection, you can actually weaken this microbiome, and it will make your immune system weaker, and you will be in a cycle of infection. A common misconception people have is whenever they have the mildest symptoms of, let's say, runny nose, sore throat,
they would take any kind of antibiotic.
They'll straight away take an antibiotic.
That's why we say always try to avoid any kind of antibiotic if you really need it, like recently need it, and you cannot. You have to take that kind. Whether we're talking about, let's say, you're having any kind of tooth pain or any kind of inflammation or any kind, I don't know, you need that kind of antibiotic, I think, is what's needed. It's not just having like any kind of flu or a fever taking that kind of antibiotic. I think because we need it more easier nowadays.
Yes, a good point to raise is that if you are going about your day just fine and you're having these mild symptoms, most of the time it's a viral infection, which means it's a virus causing the disease. If on the other hand you are feeling very tired, very malaise, high fever, then go see a doctor, and then at this stage you may have a bacterial infection. Otherwise, just take the over-the-counter medications to alleviate the pain, or take some lozenges to soothe the sore throat. And you'll be safe. You'll be fine
eventually. Yes. And I think there's two kind of antibiotics. Whether we're talking about tablets and whether we're talking by injecting the antibiotic. I think, is there a difference? Is it having the injection itself is more healing, or a result is more faster than having the tablet itself?
Good point. In general, in medical practice, we prefer to provide the oral tablets. We prefer to give oral medications because for a main reason is that there is a higher chance of what we call compliance. The patient will more likely to take the medications on time. On the other hand, taking injections requires you to go to a clinic and to have a trained nurse or a pharmacist to give you the intravenous injection of the antibiotic. And this can take time, it's invasive, it takes effort from the medical team.
But which one is more effective,
I would
faster?
I would say they're both just as effective. Maybe the injections have a higher absorption and faster action.
Yeah.
But general, looking at the let's say the bigger picture, they'll be the same.
Because we always say that not only antibiotics, any kind of let's say painkillers, we have the tablets and we have the injections themselves, but we always say if we're going to have that kind of healing itself, which is faster in order to heal, let's just go and take the injection itself. So we want to know, is this true, having the injection, any kind of medicine, it's not just the antibiotic, whether painkillers, and I think mostly painkillers, people would take it as an injection more than taking it as a tablet.
Yeah, that's a good point. Many people just go straight to the hospital saying, I want the injection. I don't want to take the tablets.
Yeah.
Yes, the injections have a faster mode of action, meaning they can be injected straight to the veins and go straight to your blood. You'll absorb it faster. But this is not a right way of thinking. You should be thinking, I might be better taking a tablet if I have it at home, a painkiller, and then you can take it frequently. Yes, the injection will have a faster mode of action, but there is an ease of taking a tablet right away. So this could put, let's say, load on the medical team. If anyone who wants the slightest pain relief, that they will go take an injection. This will just clog up all the
True. So we always say that take the medication that you need. Certainly, it's not about healing, it's about your health and being safe, of course. And we're gonna get to know more about being more healthy and pharmacist, of course, and talking more about weight loss, but after this break. Welcome back, dear viewers. Speaking with our guest, of course, today, Mr. Ali Almehanna, speaking more about pharmacists and health, of course. Now let's speak more about weight loss. And I think weight loss is being more trendy nowadays, and a lot of people would lead into different medications. Let's speak about the advancement that you may have or require for the people when they're having weight loss medication. How would you advise them? How would you differ them from nowadays and in the past, of course?
Yes, this is a hot topic right now. The whole world is talking about this new generation of weight loss medications. They come in a form of an injection. We call them a subcutaneous injection, which means they're injected under the skin. These medications, scientifically, they're called GLP-1 agonists, which means they mimic an enzyme called glucagon-like peptide. What it does is that it increases the feeling of satiety, and it will decrease the emptying of the food matter in the stomach, and this will make you feel fuller, more satiated for longer, and this is causing the weight loss. It also helps with insulin levels in the body, and has many other effects that we still are studying. But in general, they have been proven to make people lose weight up to 20% per year. It's very hugely effective.
And I think a lot of people would defer into going into these kind of, as you have mentioned, new generations, inject and so on. And I think a lot of us don't know what the effects or the side effects that might have. If you're not having it right now, you might have it later on, or it might take a long time, of course. And speaking more about these kind of new generation, what are the side effects besides you're losing weight, okay, but you're having a lot of side effects? What are the side effects?
Yes, first one out of the mind is nausea, and it's very prominent.
Yeah.
It's the actual side effect that actually helping with the weight loss. When people take these injections, they feel so nauseous, they feel sick sometimes, and this can decrease their appetite. They will not feel like eating. This helps with the weight loss. This is a side effect that helps with the weight loss. Sometimes people actually stop taking these medications because of the nausea feeling. That's the major side effect. Another side effect that can happen is diarrhea or constipation. It's actually common. We don't know why either can happen. Some can have constipation, some can have diarrhea. So make sure you speak to your doctor.
And I think a lot of people don't have that kind of energy and always feeling dizzy and maybe throwing up or vomiting and so on. I think having that kind of side effects in order to lose weight. But on the other hand, I think a lot of people would lead into doctors who are giving that kind of descriptive while checking their health and giving them the feedback. Is that true?
Yes, it's true, and that's the right way to do it. You need to see a specialist, an endocrinology specialist, because these doctors, these specialists are specialized in the endocrine system, which deals with the hormones of the body. They know how to do the right laboratory tests before you take these medications, because that's an important point. People need to check their thyroid health, because these medications can affect the thyroid levels and the thyroid glands. The endocrinologist can check before taking these medications. Make sure that you are fully checked up in that matter. Another point is that you need regular checkups.
I think you need to regularly, each month or regularly doing a kind of a blood test, of course.
Yes, make sure you're not malnourished, because sometimes these medications can make you feel so nauseous with loss of appetite. This can lead to people eating less than they need, and this can make them eat less of their required intake of protein. This can lead to muscle loss, so it can be dangerous to them.
So in order to lose weight, you're affecting yourself and your health, of course. And I think a lot of people would lead into these kind of new generations, whether we're talking about injections or whether we're talking, there's a lot of tablets people would take in order for weight loss. So speaking behind, since it's a trend and everyone is leading, everyone want to lose weight. What is the specific weight loss for the medication for the individuals that you believe in giving for the individuals in order to avoid any kind of obesity and so on?
First of all, we need to know the basics. People need to follow a right, healthy diet, to follow a good regimen of exercise, to sleep well, to have low anxiety, make sure they meditate, and to manage their stress levels, because all these things actually help with weight loss and help you manage your weight very well. You need to take these steps before thinking about taking these medications. Another point to mention is that the pharmaceutical companies who produced these medications, when they had them approved by the FDA, which is the American body of approving medications, they had their patients whom were tested on with these medications to follow a proper healthy diet and a strict exercise regimen to achieve a proper weight loss. I'm raising this point is because a common thing that happens when taking these medications is muscle loss. Is that the percentage of weight loss that happen, let's say you lose 10 kilos, maybe 3 or 4 kilograms of this weight is muscle mass. And muscle mass is very hard to gain back. So this is an important point to make sure you follow on.
And I think, yeah, we need to raise these kind of cases, because I think a lot of people would lead into taking these kind of whether tablets or new generations, as you have mentioned, injections, well, not knowing that kind of side effects that might happen. And I think a lot of people would enjoy the moment by taking it, whether we're talking about a month or so on, but they would have that kind of side effects later on. And I think there's a lot of side effects that you are getting to know, of course, because I think it's a new trend, and it's from time to time you need time in order to know what kind of side effects that's happening to the people who are taking it, of course.
Yes, exactly. Yeah. You need to be a patient who actually needs this medication. Mm-hmm. We say you have to have the right indication for weight loss, because if you're otherwise healthy and you can follow other means of weight loss, by all means, you should follow these, we call them non-pharmacological or non-medicated ways of losing weight. Because these medications we know are new, and they're a new generation. Yeah. Yes, they are studied and approved to be safe, but studies are still going on. And we don't know, maybe in the long term, maybe taking them for 5, 10 years, or maybe 15 years, maybe side effects are new, let's say, precautions. New studies come, and there are more precautions that people should know about. Yeah. So only take them when you actually need them, when you're indicated, and take them by a proper specialist advice. Don't take them on your own. Yeah, because I think we have seen a lot of cases after taking these kind of weight loss, new generation, let's say. Speaking behind of the technology and the research of pharmaceuticals, how do you stay updated with the latest developments in your field? Well, good question. We have many ways of keeping up with the latest, we say, medical evidence. There are electronic ways. They're well known. There are seminars, conferences. A well-known and popular pharmaceutical conference is called DOFAT. It happens every year, and most of pharmacists in Kuwait attend this conference. It will have updates and new advancements in pharmacy and pharmaceutical products. There's regular education in the hospital and the clinics, done by scientific teams, comprised by doctors, nurses, pharmacists. This includes having lectures, workshops, maybe online seminars, and this helps us to keep up to date with the newest medications and the newest therapies. Yeah, and I think we always say that we used to think that any kind of medication would always stay. If any kind of medication appears, it would stay for ages or for years. But with the development itself, we're always having, of course, new medications that would help everyone out there, of course. And speaking behind the development and the technology, I think there's a lot of online pharmacies nowadays, and telemedicines, of course. How do you see that kind of role, or that kind of role would affect these traditional pharmacies? And I think while you're getting online or looking into any kind of pharmacy online is different totally when you're walking up yourself and going to a pharmacy by seeing, or by, let's say, communicating with the pharmacist itself. Yes. Let's say if in a setting where there's no access to a pharmacist or no access to a primary healthcare clinic, this can have a huge role. Yeah. Let's say you live in the kilometers away, then telemedicine comes in good use, where you can access a trained professional like a pharmacist or a doctor to ask about whether you have medical conditions or you want to take certain medications and you want these questions to be answered. But in general, the best is to have actual contact, because many of the health checkups or the medical screening happens in real settings.
So one-to-one is more, you're feeling safer. I think any
Yes.
kind of patient or any kind of individual while having any kind of case or needs any kind of medication, a one-to-one is always different than having it online. I think online is more into easier being able to have that kind easy medication that you can find it anywhere, of course.
Yes,
Yeah.
we call them the over-the-counter medications,
Yeah.
or we want to use some cosmetics. These you can access if you want to take them via online
Yeah.
means or applications. Otherwise, prescription medications, or if you want medical advice, then you should access it by yourself.
Of course.
Yes, to have maybe certain questions will come up when you meet the health professional or the pharmacist.
Yeah. And last not least, I'm sure you had a lot of challenges facing a lot of things with whether patients or whether different individuals. What's the last advice that you would give, especially in these kind of field that you have been working in?
I think a good advice now with the increasing publicity of social media, many people follow maybe the celebrity or a famous person with their advice about taking certain medications or certain cosmetics. I would advise that only ask a trained professional, a pharmacist, double check with your local pharmacist or in your primary healthcare clinic.
Yeah.
They're always available. You know, it doesn't take maybe 5 or 10 minutes to check on the medication you want to take. Don't just buy it or order from online and take them without advice, because many, even herbal medications or vitamins, they can have a bad effect on your health without you knowing.
Indeed. Yes, of course. It was an honor to have you with us and around Kuwait, of course. And I think the last thing we would say for the people is always lead into whether we're talking about a doctor or pharmacist or any kind of experts that really knows what kind of medication that you need in order to be more healthy and to be safe, because at the end of the day, this is your health and you should take care of it, of course. And thank you so much again.
Thank you so much, Sarah.
With that, dear viewers, we had our guest, of course, Mr. Almehanna, knowing more about medications and taking care of our health. See you soon with a new episode, and goodbye.